Hello and welcome back to the Patient First Podcast. I am your host, Dr. Bryan Laskin, where I am very excited to help increase the influence of today's engaged dentists. And today I'm extra excited because we had a win in dentistry relatively recently, and it's a rare one. It's like finding Sasquatch, the Loch Ness Monster, the Easter Bunny, and other mythical creatures. This is an instance in popular culture of dentistry being uplifted. Like a lot of what gets reported in dentistry, obviously it's from one person's perspective. So I like to think that, the way that laws get passed, the way that stuff happens, usually it's like something directly happened to that person. And in this case, that's exactly what happened. There is a person who is a writer at a very popular magazine that had a positive dental experience and decided to write about it. And this is big news because it's such a shock to the readers that Amanda Mull, who's a writer for The Atlantic, wrote a story called The Myth of Root Canals. Good news, they are no longer terrible, right? It's no longer a horrible experience getting a root canal done. Now, this is an odd thing, I thought. When at first I was like, oh, this is great. It's a writer writing something positive about dentistry. And then I thought about it and I was thinking, why is this such a big deal? And many of you listening today might be thinking the same thing. Why does The Atlantic, which is a very popular, well-read, well-respected magazine, I believe. I don't read it very often, but it came up in my feed because obviously I am a dentist looking to increase the influence of today's engaged dentists. And when somebody says that dentistry isn't terrible, it is news. Somebody had a positive dental experience. Why is this news? In the year 2020, this is a common procedure that almost every writer is probably having done at some point in their career. And dentistry, root canals in the year 2020, maybe, if you really don't pay attention to it that much, maybe 5% of the time should a root canal have a negative experience versus somebody who's just going and having routine care, coming out going, boy, I've heard horrible things about root canals. And guess what? That wasn't terrible. In the year 2020, 95+% of root canals should not be terrible. But this was a big story, so much so that it was featured in the magazine online, and it came up in my feed and I read it. Why is this such a big deal? I believe it's because we need to directly address patients' anxiety. Obviously, I talk about it on the podcast, the Patient First Manifesto, my book. If you don't have a copy, get one for free. The link will be around here, around this video. But we need to directly address the fact that somewhere between 60 and 80% of our patients have anxiety. And when they come in and have a root canal done, they have a positive experience, they can write an article and it can be featured in a major magazine. That is a problem, I think. It's good news that this person put that out there. But the fact that this is news is kind of a little bit grim if you think about it. And we live in a world right now where 71% of dentists are reporting higher rates of bruxism. We have much more work to do than we did pre-pandemic. And so I just wanted to get this out there, that this article that I read that was talking basically about the fact that the root canal didn't hurt, it wasn't horrible, it was a relatively painless, easy, smooth experience. That should be the norm, right? So if you are not having, first of all, if 95% or plus of any procedure you're doing isn't terrible, right? Maybe it's time to rethink your technique, because in the year 2020, I believe strongly that almost everything we do in dentistry does not have to be painful as long as we manage anxiety. So what does that mean? What does managing anxiety mean? Sometimes it means just giving a painless injection. Sometimes it means talking to the patient, listening, and getting treatment done that day so they don't go home and worry about it for a month if they have an issue. Sometimes it means actually using some type of sedative, be it nitrous oxide, therapeutic virtual reality like Opera VR, and I can put the link to that in this around this video too. And just frankly, if a patient has too much anxiety and it's going to be a terrible experience and you don't offer sedation, refer them to somebody that does. In a world where 71% of people are bruxing and already stressed out of their minds, I think we need to have more experiences like Amanda had at the dental practice, where they go away going, wow, dentistry has changed. It is not what I expected. It is not terrible. In fact, I actually went out there and those people seemed to be enjoying their jobs and they liked what they do. And it was a positive experience. So much so that I want to shout from the rooftops. That will help everybody. It'll increase case acceptance. It'll increase, right now, 25% of patients, adults in the US are walking around with active caries. We have to address this. And if something that a simple procedure like a root canal as elevated to not being terrible can make a huge news, right? We have some work to do. So hopefully you're here listening. Obviously you're here and listening. So thank you for being an engaged member of the dental community, looking to put patients first and helping to generate more articles like this so we can flip the patient perspective and help elevate our patients' oral health. Thank you very much again for showing up, for being part of the dental industry that's looking to help patients. And by the way, that is the best way to grow your practice also. Look forward to seeing you next week on the Patient First Podcast.